I'm speaking with Dr. Larry Eichenfield of San Diego, who has been involved in a really massive study of patient-reported outcomes, an 800-pound gorilla study on the issue of hormonal contraception and acne. Tell us about the study.
Well, this was an interesting study. Dave Lorcher has a internet-based acne group, and basically had a large set of patients who were seeking out help for their acne. And he had some data in there. He had asked over 2,000 patients at the time about whether they were on any contraception, and if so, how they thought it affected their acne. So along with Shayla Admani and myself, we plumbed the data. An example is sort of using big data and looked at that question, and it was really fascinating results, because what it showed is that sort of as expected. So, progestins are present in birth control for the birth control, but they're not usually good for the acne, other than the newer synthetic progestin, drospiridone. So otherwise, progestins are bad. So there was a very clear gradation in terms of worsening of acne, and things such as hormonal IUDs that are progestin only, or some implants that were progestin only, were correlated with worse acne. And then in the combined oral contraceptives, those that had drospiridone in it performed best, and then certain subclasses of the combinations with ethinyl estradiol and certain estrogens did better. And interestingly, something that hadn't been seen before, it looked like the triphasic products, where the progestin's in 3 phases, so it's sort of gently done over time, had better impact on the acne than just the dual ones, which sort of makes sense, because if the progestin's the negative, giving it more slowly over time for the contraceptive aspect of an oral contraceptive, is probably gentler from an acne standpoint than in the biphasic.
What's cool about this is it's more than 2,000 consecutive women, and it's straight from their mouth to your ear.
Yes, with the internet in between.
Yeah.
But it really was patient-reported outcomes, so I thought it was nice to get it in the literature, both for that reason, as well as also to inform us on both how we should prescribe hormonal therapy for acne, but also to make dermatologists more knowledgeable about the impact of contraception in general.
You mentioned drospiridone. Are you reluctant to prescribe that?
Well, a few years ago there was more concern about drospiridone having a higher rate of blood clots as compared to some of the combined oral contraceptives. A lot of that data was re-looked at, and there were meta-analyses that came away without that takeaway. So I'm not really reluctant at all to use drospiridone. It's a really nice product from an acne standpoint and an effective contraceptive. With any oral contraceptives, though, we're trying to assess risk factors. So if there's an immediate family member who's had blood clots, if you have a smoker, that's different. Most of the time in our adolescent and young adults, that's not the case, and then it's pretty safe to use.